Did you know that seemingly harmless vitamin pills can become a double-edged sword if used incorrectly? In fact, thousands of cases have faced serious health problems simply due to misunderstandings about how to take vitamins properly. At 60, a woman always prided herself on her health. 2 months ago, her doctor noted slightly elevated creatinine levels but assured her they could be managed. Determined to improve, she turned to advice from friends and online forums. Vitamin supplements, herbal medicines, and a high-protein diet soon became part of her routine. But within weeks, her body rebelled. Fatigue, swelling, and nausea struck hard. A hospital visit revealed the shocking truth: her creatinine levels had skyrocketed to 3,530 milligrams per deciliter. Her kidneys, overwhelmed by the sudden strain, had rapidly deteriorated. You might be taking it every day without even realizing, a vitamin that seems safe but is actually the cause of a woman's rapidly deteriorating kidneys. How could something so familiar become such a deadly threat? In this video, we will reveal the frightening truth behind this common vitamin, why it causes rapid kidney decline, and how you can protect your health. Don't miss out, as this could directly affect you or your loved ones. Let's start with the least dangerous, our number 5, and then we will see vitamins that are increasingly worse. Vitamin D is actually a type of vitamin that can be very good for you if used correctly. It is an essential nutrient that helps the body absorb calcium and phosphorus, while also supporting strong bones. The body can supplement vitamin D through sunlight, food, or dietary supplements. Vitamin D plays a crucial role in maintaining stable levels of calcium and phosphorus in the body, which is vital for the development and maintenance of bone structure. In addition, providing adequate vitamin D also helps prevent osteoporosis and supports the immune system. However, if vitamin D is taken in excess, it can lead to serious issues such as high calcium levels in the blood and high phosphorus levels in the blood. When calcium levels in the blood are too high, the body absorbs too much calcium from food and bones, causing health problems such as nausea, fatigue, muscle weakness, joint pain, and possibly leading to kidney stones. Similarly, excess phosphorus also disrupts the mineral balance in the body. One of the most serious effects of taking too much vitamin D is kidney damage. When calcium and phosphorus levels in the blood are too high, the kidneys are overloaded trying to filter and excrete them, which can cause kidney stones and may lead to kidney failure if not treated promptly. This condition can reduce the kidney's ability to filter, leading to the risk of chronic kidney failure. The main cause of vitamin D overdose is the abuse of supplements without consulting a doctor or increasing the dose without medical supervision. To prevent this, users should follow the correct vitamin D dosage, consult a doctor before using supplements, and monitor their health regularly to check calcium and phosphorus levels in the blood. Vitamin D is an essential nutrient for the body, but overdosing can lead to serious problems like high calcium and phosphorus levels in the blood, leading to kidney stones and kidney damage. How can we avoid this? Well, take vitamin D at the correct dose, usually around 2,000 IU per day, and always take it with 100 mg of vitamin K2 to prevent calcium buildup in the arteries, and with magnesium. This is how you take vitamin D safely. In fact, there is another type of vitamin that you must take, but you need to be careful. The synthetic form of this vitamin can actually turn into a toxin. Number 4 is cyanocobalamin. Cyanocobalamin is the synthetic form of vitamin B12, commonly used in vitamin B12 supplements. Vitamin B12 is an essential vitamin that helps the body maintain important functions such as red blood cell production and supporting the nervous system. Cyanocobalamin is used in supplements because of its stability and ease of storage. Once introduced into the body, cyanocobalamin is converted into active forms such as methylcobalamin or adenosylcobalamin. These forms help the body produce red blood cells, protect nerve fibers, and support the function of many important enzymes. However, one potential issue with using cyanocobalamin is that its metabolism produces a small amount of cyanide ions, which is a toxic compound that can harm the body if accumulated in large amounts. However, the amount of cyanide produced from cyanocobalamin in the body is very small and is typically converted into thiocyanate, a less toxic substance, before being excreted through the kidneys. Although serious side effects of cyanocobalamin are rare, for individuals with kidney function issues, the accumulation of thiocyanate or cyanide can pose some risks. The kidneys are the primary organs responsible for filtering and excreting waste from the body, and if the kidneys are not functioning properly, waste products from cyanocobalamin may accumulate and affect other physiological functions. Despite the presence of cyanide toxin, with appropriate dosages and under normal conditions, cyanocobalamin remains a safe option for most users, especially for those with vitamin B12 deficiency. Studies show that cyanide poisoning from cyanocobalamin is extremely rare and typically only occurs when the dose exceeds the recommended levels or when the body has metabolic issues. Next is number 3. This is even more dangerous. This daily vitamin you're taking might actually be making you sick. Studies have linked it to significant increases in blood pressure. It could even raise the risk of stroke and cancer. Other studies indicate it could lead to bone loss, increased cholesterol levels, and even kidney damage, even in the general population. Yet this vitamin is still being produced despite all these dangers, so be careful and never take alpha-tocopherol, the synthetic form of vitamin E. Vitamin E is a fat-soluble vitamin that plays a crucial role in protecting cells from damage caused by free radicals. Among the various forms of vitamin E, alpha-tocopherol is the most common. Vitamin E can be derived from natural or synthetic sources, with synthetic alpha-tocopherol being artificially produced and commonly found in dietary supplements. Both natural and synthetic vitamin E have positive effects on health, such as protecting cells, acting as an antioxidant, and supporting the immune system. However, with the synthetic form, if used in high doses over an extended period, it can cause some concerning side effects. One of the side effects of synthetic alpha-tocopherol is increased blood pressure. Studies show that using synthetic vitamin E can raise blood pressure, particularly when used in high doses for long periods. This can lead to serious cardiovascular issues, as high blood pressure is a major risk factor for heart disease. Additionally, using synthetic vitamin E can also increase the risk of stroke, especially hemorrhagic stroke. Some studies suggest that high doses of vitamin E can affect the function of the blood vessels, increasing the likelihood of bleeding in the brain. Furthermore, prolonged use of synthetic alpha-tocopherol may affect bone density, leading to osteoporosis. This occurs when synthetic vitamin E reduces the body's ability to absorb calcium, thus increasing the risk of fractures, particularly in older adults. Another risk is kidney damage, as prolonged use of synthetic vitamin E can increase oxidative stress on the kidneys, leading to cellular damage. Compared to natural vitamin E, synthetic vitamin E has weaker antioxidant effects and may cause more severe side effects, especially when used in high doses. Therefore, consumers should be cautious when selecting vitamin E supplements and avoid self-administering excessive doses to ensure safety for their health. Number 2. Now, there is only one type of vitamin that is even more dangerous than alpha-tocopherol. Number 2 is a vitamin that can harm your kidneys even if you only get it from food. There is only one type of vitamin that can do this. Number 2 is vitamin A. Vitamin A is an essential vitamin for the body, playing an important role in maintaining eye health, skin, and the immune system. This vitamin can be obtained from foods like carrots, green vegetables, or from foods containing retinol, the active form of vitamin A, such as animal liver. Vitamin A is a fat-soluble vitamin, which means that the body can store it in fat tissues and the liver. Therefore, excessive vitamin A supplementation will not be immediately excreted but will accumulate in the body over time. This accumulation occurs when we consume too much vitamin A from food sources or supplements. Vitamin A toxicity happens when the body absorbs too much vitamin A, exceeding its capacity to use it, and it can cause a range of symptoms, from mild issues like nausea and fatigue to more severe symptoms. Excessive vitamin A can cause damage to many organs in the body, including the kidneys, liver, and other soft tissues. When the body cannot process the excess vitamin A, negative effects begin to appear. One of the most serious consequences of vitamin A accumulation is kidney damage. The kidneys are responsible for filtering and removing waste from the body, and if the kidneys are damaged by too much vitamin A, this filtration process will be affected, leading to waste buildup and the risk of kidney failure. In addition, vitamin A toxicity can also cause hypercalcemia, increasing the burden on the kidneys, which can lead to further weakening or damage. When the level of vitamin A in the body becomes very high, it can lead to acute damage, with symptoms appearing quickly and causing serious immediate consequences. Symptoms may include severe headaches, dizziness, nausea, loss of appetite, and, in severe cases, may lead to cardiovascular or neurological problems. Particularly, if this condition is not treated in time, there is a risk of death. Both consuming vitamin A from food and from supplements need to be carefully controlled. Although natural foods providing vitamin A have a lower risk of toxicity, using vitamin A in supplement form can easily lead to excess if the recommended dosage is not followed. Vitamin A is an important nutrient, but when used incorrectly or excessively, it can cause toxicity and severe damage, especially to the kidneys. Therefore, attention must be paid to the amount of vitamin A consumed, especially when supplementing with pills. Maintaining balance is key to ensuring optimal health and avoiding negative consequences. It's time to talk about number 1, and I bet you're curious to know which vitamin ruined the kidneys of the 60-year-old woman I mentioned at the beginning. Vitamin C, ascorbic acid, is a water-soluble vitamin that plays an important role in antioxidant processes, protecting cells, supporting the immune system, and synthesizing collagen. It is commonly supplemented through food or pills to provide the necessary amount of vitamin for the body. However, when vitamin C is consumed, the body metabolizes it, and most of it is excreted through urine. However, a portion of vitamin C can be converted into oxalate, a chemical that can combine with calcium in the body to form calcium oxalate crystals. When the oxalate concentration in the body is high, these crystals can accumulate in the kidneys, leading to the formation of kidney stones. Using high doses of vitamin C, such as 1,000 milligrams per day, can increase the amount of oxalate in the body. Research shows that prolonged high-dose vitamin C use can contribute to the formation of oxalate crystals in the kidneys, increasing the risk of kidney stones and kidney damage. This is especially true for those with pre-existing risk factors, such as people with a history of kidney disease or a low-water diet. High-dose vitamin C use can lead to kidney failure. In the case of the 60-year-old woman taking 1,000 milligrams of vitamin C per day, the formation of oxalate crystals in the kidneys is a possibility. The high amount of vitamin C will increase oxalate production, and if the body cannot expel it quickly enough, these crystals will accumulate in the kidneys, causing damage. The formation of oxalate crystals in the kidneys can lead to serious problems such as nephritis, kidney tissue damage, and if not treated promptly, it could result in permanent kidney failure. Vitamin C is an important element in the diet, but high doses need to be carefully controlled to avoid serious side effects, especially when unsupervised. This is particularly true for older adults, when kidney function may already be compromised, and high-dose vitamin C use should be carefully monitored to avoid serious complications, such as permanent kidney damage. Let's take a moment to think about something that affects so many of us. This isn't just an isolated case, it's happening with countless brands out there. That's why this is our top concern today. A lot of people believe this vitamin is harmless, but the truth is, it's not always as safe as we think. It's a heartbreaking reality, and a powerful reminder. Please, always be cautious about your vitamin doses. Just because a little bit of something is beneficial, doesn't mean more is better. If you're taking vitamin C, it's important to check your dosage carefully. While 100 mg a day is usually just fine, taking 1000 mg can seriously harm your kidneys. So, take a moment to double check and make sure you're not overdoing it. Thank you for taking the time to watch, and may God bless each of you. Please like and subscribe to the channel for more great videos.